John. For those of you who are new to us this week, we always start out with some exercise because, as Cornelia said earlier, what's good for the brain, what's good for the heart is good for the brain. There's a big connection between good cardiovascular health and brain health, and that's one of the things that we like to promote. So what do we do here at the Alzheimer's Disease Research Center? Well, Alzheimer's is one type of dementia, and other than Alzheimer's, there are a number of other disease processes that are at work in what we call neurocognitive disorders. It's a spectrum of disorders. So the Emory Alzheimer's Disease Research Center is one of over 30 centers in the United States that is conducting research into neurocognitive disorders like Alzheimer's. And as we've talked about before, there are many different types of dementia. Alzheimer's is the most commonly diagnosed, probably because it's the one that we have the most information on. But aside from learning about Alzheimer's and related dementias, one of the things that's real important to getting to the root cause of why there is an Alzheimer's or why there is any other type of neurocognitive disorder or dementia is, what are some of the risk factors? What are some of the things that we might be able to do to prevent brain dysfunction or from keeping our brains from remembering and working like they're supposed to? So part of the mission of the Alzheimer's Disease Research Centers around the country is to evaluate things like this. We need your participation. We need the participation of all older adults, certainly 65 years of age and above, all women, all men, all ethnicities. And more importantly, the work that goes on in all of these centers is different. They're not all working on the same projects. Different centers have different projects that they're offering, but we do have a few that are pretty much the same. At this point in time, I'd like to turn our program over to Dr. Nina Silverberg. We want to protect her time and let her talk to you for the next 15 minutes to tell you a little bit more about what the National Institutes of Health, National Institutes of Aging does and how we facilitate research with older adults. Dr. Silverberg is the program director and has served as a program director for all the Alzheimer's disease research centers in the country since 2005. So she's had more than a decade of experience working with centers much like the Emory Alzheimer's Disease Research Center. In addition to working on research or promoting research in our Alzheimer's Disease Research Center, she works on other initiatives to increase the number of older adults that are participating in clinical research, but she also works very hard to try to ensure that all groups of people are represented in the research that is conducted in our different centers. At this time, I'd like to introduce to you Dr. Nina Silverberg, who directs all of our nation's Alzheimer's Disease Research Centers. Dr. Silverberg, where is she?
Okay, I think I'm sharing my screen. Yes. How's that look to you? Wrong.
Good.
Do I need to switch the view?
There we go.
I do. It's showing up as the wrong view, right?
National Institute of Aging
and
Alzheimer's Disease Research. I have one big slide. Now you've got two. Now you got two.
Now I have two. Okay, let me try that again. How's that?
Good. One page, just one screen.
Okay. Okay. Sorry about that. Okay. Thank you, everybody. And thank you to John Lewis. I was dancing along there and really appreciate that start. And thank you to Dr. Parker for inviting me and for hosting this program. I appreciate the invitation and look forward to hearing your questions about my presentation. I'm just going to talk a little bit about the National Institute on Aging and a little bit more specific about the Alzheimer's Disease Research Centers program that Dr. Parker introduced. I run the program along with my colleague Cerise Elliott, and Grayson Donnelly helps with support of everything that we do. And my contact information is there for email and for Twitter if you'd like to reach out. I'd love to hear from you. So I just wanted to give you a little bit of background. The National Institute on Aging is part of the National Institutes of Health. There are 27 institutes and centers within NIH, and NIH is part of the Department of Health and Human Services in the executive branch of the government. And you can see here we have the Office of the Director, and NIA funds both intramural research, which is direct research conducted by NIA and NIA scientists, and the extramural research. And our extramural research funds research across the country and other places in the world as well. And we have 4 divisions within the NIA. We have the Division of Aging Biology, we have the Division of Geriatrics and Clinical Gerontology, the Division of Behavior and Social Research, and I'm in the Division of Neuroscience. And the NIA funds a lot of research on aging, looking to extend healthy, active years of life. And NIA is the primary federal agency supporting and conducting Alzheimer's disease research. And you can read a little bit more about NIA at the link there. And I will be happy to share these slides if it's helpful. NIA also has a lot of general health information for older adults. There are more than 200 articles on the web covering topics related to aging and diseases and conditions of aging, including vaccination, physical activity and exercise, healthy eating, and a lot on Alzheimer's and related dementias. And you can actually access not only what's on the web, but you can also have publications sent to you or to an organization for free. And so those are the links below to read and order some of that information. And then we also now run the federal government's Alzheimer's information webpage called Alzheimers.gov. And here's a little bit more information about that website. It's a relatively new federal portal for information on Alzheimer's and related dementias. I think most people, as Dr. Parker was saying, have only heard of Alzheimer's, but there are many other types of dementia and other causes for dementia that we're still trying to learn about and hopefully treat. So the website has tips and resources for people taking care with people with dementia, information on participating in clinical research and how to find trials and other studies. We think it's important for people to know that it's not just clinical trials that you can participate in. There are resources for healthcare providers as well. If you are a clinician or a community or public health worker or other researchers, there's also information available on that website. And then updates on federal government activities that address Alzheimer's and related dementias. And so I'm going to talk a little bit more about the Alzheimer's Research Centers. They are labeled Alzheimer's Research Centers, but they actually conduct research on not only Alzheimer's disease, but also those related dementias, which includes frontal temporal dementia, Lewy body dementia, mixed dementia, and vascular dementia. So these centers serve as a resource and infrastructure for the full research community and provide a lot, which I'll be showing you in a minute, for the rest of the research community, not just people at the Alzheimer's centers. But at each center, as some of you may know if you went to Emory, provide diagnosis and education services for people living with dementia and their families and other people who interact with them, their care partners, and opportunities to participate in many types of research. And I think it's really important also to point out that they help to train the next generation of both clinicians, people taking care of folks, and researchers. So we recently, in this past September, expanded the Alzheimer's Disease Research Centers to include 4 exploratory centers. So we've really expanded geographically, but also the types of communities that the researchers are looking at, and also some of the scientific areas of focus. So you can see we have these 4 exploratory centers in Nevada, New Mexico, Tennessee, and Alabama. And as Dr. Parker also mentioned, I take it very seriously that we're trying to include everyone in research for dementia. And so part of the way that we do this is to help the researchers engage all segments of the public to focus on some of the communities that have been underrepresented in research. I think it's very important that we specifically include the people that are most affected by dementia and related disorders. So we've worked really hard to provide information to help with that. And here are some of the types of diversity that we see across the country in our different Alzheimer's centers. Some have a focus on rural communities. Some have a focus on African American, some have a focus on Asian, Latino, Native American, and then we have some other types of populations with centers with expertise in those areas. What we do is we take all that data from over 30 centers across the country and we send it to the coordinating center in Seattle. And we have images, we have samples, and those get sent and connected to the data. And so that's available to researchers, not only across the country, but across the world. And my next slide, I hope this is okay to bring up. I hope it doesn't make anyone uncomfortable, but part of where we get the information about new ideas or what may be causing Alzheimer's is from people's brains after they pass away. And so part of what I've been working really hard on is to not only increase the number of people willing to donate their brains or at least consider it, but also to increase the diversity of the people, because the largest proportion of the brains that we have that we've done research on are from white Americans in this country anyway. So I think that we really need more diversity, and we need to help people understand why it's important to donate their brain. And so we have this website that's listed there, Brain Donation, a Gift for Future Generations, that helps to hopefully explain what the value is for research. And I also included this link to, it's an older article, but I think still quite relevant. The author of the article in The Atlantic, her grandmother, had agreed to donate her brain. And so the author went to the place where the grandmother had agreed to donate the brain. So I think it's a well-written article and helps to explain why it's so important. So that's all the slides that I had presented. And I'm really, really happy to take any questions that you have.
So Nina, one question that came up in the chat, and we get this kind of like every week, has to do with medications like brain supplements to help improve memory. What does, or how is that kind of research tested in our Alzheimer's disease research centers or not? We've said before that we don't really support those kinds of things, but people ask those questions. Does the National Institute of Aging, National Institute of Health regulate any of that kind of activity? And does any of that science figure into what we do in the Alzheimer's Disease Research Center?
So the FDA regulates medications, but they do not regulate supplements. And so it is possible to conduct research on supplements for NIH to fund research. And Dr. Parker correctly points out they're not effective. That's what the evidence shows, but researchers do propose occasionally to study supplements. Ginkgo biloba is an example that was studied in an NIH funded research study and shown not to be effective. Vitamin E was studied. So they go through the same process that other grant proposals go through. A scientist writes an application, and it's reviewed by peers, other researchers, and they decide based on what's in the application whether it seems reasonable to study. And then if it scores well, and we have multiple other steps of review to make sure that the application is appropriate in various ways, it might get federal funding for research. And then after the research is conducted, it hopefully gets published in a peer-reviewed journal so that others can see, even if it's negative, they can learn from the study. So that's how general research works. And there have been studies on supplements, and so far, unfortunately, none of them have been truly helpful in the way that we might hope, except for exercise. It's not a supplement, but exercise is the best help we have found so far. So that was a great way to start this meeting. And then I did see a question about brain donation and whether we need people without Alzheimer's. And yes, that's a great question. And that is exactly what we need. We are really low on people who pass away who have what the field calls control brains, which is people without disease. It's hard to find those people who are willing. Often it's a family member or something. We do have some, but that is our biggest need actually, is people without dementia. Okay, now I can't keep up with the questions.
Okay, so let me just help with one of those things for Dr. Silverberg. Here at the Emory Alzheimer's Disease Research Center, we do accept brains and spinal cords for autopsy. But even if you're healthy, whether or not you have the disease, but what we would prefer is that you enroll in what we call our memory study. That's where annually you'll get kind of like a little memory test, a little memory screen. You may draw your blood, maybe get an MRI, maybe even a lumbar puncture. But what we try to do in our Alzheimer's Disease Research Center is we try to follow not only people who have cognitive impairment, but people whose brains are functioning normally. I think I'm pretty healthy, but if I get to 65 or 70, in order for my family to get my brain properly characterized when I no longer need it, I need to be a part of our unified data set or our UDS study. And that's a study of people that we're collecting information on. We're not looking for disease. We're just trying to see how we age, see how our memory tests change every year. Dr. Silverberg put in the NIH website, but I think Crystal is looking for the number to give you to participate in our memory study, whereby we then collect you for, get you to sign up for the autopsy study. We don't necessarily want people, for example, to die today and say, I want to donate my brain if we don't have any information on them. That makes it a little bit difficult. Depending upon where you are and what your requirements are for our brain autopsy and donation here, we like to have information on you ahead of time. And it's important for you to know that when you donate your brain, we like to have it before the mortuary gets it and they start the embalming process, because things change when that process develops. So the process of autopsy requires that you get the brain as soon as it's available, but before the embalmers have a chance to fix it. There's a very specialized process that goes on for doing that. And once your brain is harvested, that doesn't mean that you can't have a standard funeral and get all dressed up and all decked out, if you will. You can still have a traditional funeral service with a body viewing. Harvesting your brain does not keep you from having that done. But again, Crystal's going to try to look up some things to put it on there such that you get more information about what we do here at Emory and get a number. And if not, Crystal will put her own number in there and get back into you. And there's a question here, and I'm just answering this generally. Is the process the same as for organ donation? No, it is not. When you are harvesting the brain and the spinal cord, there's a very specialized thing that we're doing with it. People who donate their bodies to science. If you donated your body to science at Emory and say, oh, well, give the Alzheimer's Disease Research Center my brain, they're really two different schools that you're donating to. So if you want the Alzheimer's Disease Research Center to have your brain and your spinal cord, there's a very specific set of things we want you to do. If you want to donate your whole entire body to science, and that's for the medical students and other students to learn anatomy on, that's a different process. They're not the same. And donating your body to science won't mean that the Alzheimer's Disease Research Center gets your brain and your spinal cord. So Crystal, okay. So harvesting the brain has to take place prior to the body going to the funeral home, prior to embalming. It's usually done in the hospital. Here at Emory, if you're signed up in our brain donation programs, once they know that your body is, that you're a candidate for autopsy, they do it without charge in the hospital for Emory University patients and admits who are committed to doing that. But again, here in the Alzheimer's Disease Research Center, we want to have a relationship with you before you no longer need your brain. And that's why we want you to enroll in our unified data set or our memory study. Dr. Hepburn?
So can you explain if I want to donate an organ, say I want to donate my eyes or my kidney, can I do that and donate my brain, or is it an either or?
I think you can do them all. It just needs to be clearly spelled out. The people who know what it is you're wanting to donate need to be aware of that. And again, for anything that you're donating, your human remains, there is a process. So if you want to donate your corneas, there is a process by which you do that. And that doesn't mean that you can't donate your brain or your spinal cord. It just means that if that's your intent, we need to make sure that you get to the right people so that your family has the right number to call so that you can get your eyes, your kidneys, your liver, whatever it is you want to donate. But donating the brain and the spinal cord is a process. And here in the Alzheimer's Disease Research Center, we do have a number, we do have a person who does that. Dr. Marla Gearing has been on before to talk about that process. But again, here we like to study you ahead of time such that whatever it is we observed while you were upright and walking is what we find when we do the pathology on your brain. So it's a long-term, it's an observational process. And again, when you no longer need your brain, we would like to have it, but we want to establish a relationship with you first. I have a 95-year-old mother who, when she could tell me she wanted that, said, oh, you can have my brain. I won't need it anymore. So she's a part of our Alzheimer's registry. And when she no longer needs her brain, she's given me permission to give it to Emory.
I'm so excited with all these questions, but a lot of them are answered in that article. So I hope that you all will take a look at it. It does address this question about organ donation and about whether you have to have disease and what to do if you're in another state. And the fact that Dr. Parker was just explaining about how we want to see people before they pass away so we understand how that relates to what's going on in their brain. All that's in there. So I hope that you'll have a chance to take a look.
Can we go back to two issues? One, just debunking the use of supplements, and then also the types of research. While we're talking about this longitudinal study, we have so many other study opportunities, as you mentioned, Dr. Silverberg, that I know Dr. Parker is involved in, Dr. Hepburn. So if we could address those two.
Yeah, I actually wanted to jump in when you were talking, Nina, because I think one of the really important goals for the Alzheimer's centers is not only discovering, the cause and early diagnosis, but also research around care and treatment. And so there's a whole lot of studies that we're doing, but studies that are being done across the ADCs that are focused on really developing caregiver mastery, the ability to manage all the different information that they have to manage to do day-to-day care, but also to handle the kind of claims and misinformation that are happening each day, being able to assess it, knowing what good sources of reliable, credible information are. So I think that's an important function for the ADCs to really be developing stronger caregivers. We had Allison Lindauer on last week, who has one of those programs. We're developing some programs here about how to navigate systems of care and how to assess information. And I know that's true across the centers.
Okay, Dr. Silverberg is trying to type in some answers to some questions about expansion centers. And while she's typing that in, Dr. Silverberg, would you mind explaining to people what an expansion center is? If it's not an Alzheimer's disease research center, what is it exactly? What's an expansion center?
We call them exploratory centers. So they were from across the country where we were really looking to explore opportunities to get different types of participants included, different areas of research focus. And so we requested, NIH has sometimes requests for applications that are very specific, and this was one of those. Otherwise, scientists can just come to us with their ideas, and all the applications get reviewed by other scientists, and they give feedback and scores. And the ones that get the best scores are usually put forward for funding. And again, they go through multiple other processes before they would receive federal funds. But after they get reviewed by other scientists, and then there's a council, and then the program staff in the extramural program at NIH review them, and the director of the institute. And so lots of people take a look and make sure that they believe that the science will be successful. We never know for sure. Sometimes we take chances, but they get reviewed, scored, reviewed again, and then funded. And then we keep up with them yearly. They provide a progress report on how they're doing. So these are exploratory centers that were supposed to expand the areas, and those were the ones that got the best scores.
So for example, out in New Mexico or Nevada, would, let's say, well, here in Atlanta, one of the predominant ethnic groups is African American. In Nevada and New Mexico, would you be focusing on Native Americans or Latin Americans? Is that the objective, or rural? Or
Nevada is actually focusing on both rural and African American populations there. And the New Mexico Center is indeed focusing on Native American populations at that one.
Okay. All right, that's very helpful. So that kind of helps a lot. That explains why it's important to expand our research pool. We have to have everybody. So different populations. In Georgia, we have a large number of African Americans. In the Pacific Northwest, in Washington, Oregon, they have people who are Asian and Pacific Islanders. So ethnic mixes are a little bit different geographically. Okay, so let me see. There's another question on Riluzol study. I'm not exactly familiar with that. I know we don't have that here. It may be available at another center. Okay, Cornelya is going to answer that question. Cornelya? I think she's gonna.
Yeah, we record every session, and if you are on our listserv, you will get a link, and the link is embedded in the email. So make sure you check your email and check your spam.
And I saw there was another question about the ENACT legislation. I am familiar with it. I have to say, though, that as part of the executive branch of the federal government, we're not allowed to interact with lobbyists or discuss potential legislation, especially that involves funding. But I certainly support the idea of increased participation of underrepresented populations. I don't know if there was another question about it. But.
That's probably a little different. And I think it is important for people to understand that the National Institute of Aging, National Institute of Health is not a political entity. We don't decide policy. Those are a little different. So science is science and politics is politics, and Sometimes it's the politics that helps get our science organizations funded, but we are not advocacy organizations as such, right? Okay, I'm trying to see what else there is. I think if there's not something else, you had some really good information, and Cornelya is going to send the link. We're going to go back to the link for the National Institute of Aging, National Institute of Alzheimer's, National Institute of Aging, National Institute of Health's website, whereby you can get the information on not just Alzheimer's and research centers, but also about how to age healthfully and get materials for whatever organization it is you need. And Dr. Silverberg, can I trouble you to put that website into the chat again, please? It's in the slide deck that we'll send, but people may want special information on aging that comes from the NIA. And I'm looking, we have over 223 people at the type, probably a little bit more. So I think that for other people that are listening that are local, we have our Emory Alzheimer's Disease Research Center, www.alzheimers.emory.edu. We have a web page there, and we have all studies that we are conducting here that may provide you access to research here. There's even information about brain donation here at Emory. Again, that's Emory, www.alzheimers.emory.edu, and you will get to our Alzheimer's Disease Research Center webpage, email. Okay, let's see what else we have. Okay. They put the website for the Emory Alzheimer's Disease Research Center up there for you. There's some very specific questions in the chat about autopsy and how that's done. Unfortunately, I can't provide an answer to that question, but if you're interested in brain donation, we're going to give you that information. Again, that is also available on the Emory Alzheimer's Disease Research Center website here. But you may also confer with your local mortician to find out where and where you might be able to make that kind of donation. Again, in the chat is the information about brain donation and gifts for future generations. That's sponsored by our National Institute of Health. Okay, so let me see what else is in here. Do you have any news on? Okay. Mr. I can't say his name, but I'm going to call him Mr. Nicholas, asked question about any news on the new meds Aduhelm. I think that's what he's trying to say. And I think that we've discussed that during our town hall, but is there anything, Dr. Nina, you want to add about that or drug trials in general?
I did put a link just before the last one I put about how you can learn more about clinical trials in general. So you might want to take a look at that one. About Aduhelm, I can't say too much. I can say, I think probably many of you have read, there is controversy around this particular drug that has not been the case previously. Part of the reason for that is because it was granted approval in sort of a different way than many other drugs under accelerated approval. And it was also approved because the FDA decided that there was sufficient evidence that it was able to clear amyloid from the brain. And there had been previous work, quite a bit of it, showing that amyloid is very related to Alzheimer's disease. There are many, many controversies, which I'm sure you probably discussed at your previous meeting, about not only the drug, the approval, but also about the definition of Alzheimer's as a biological entity. A lot of the science that happens, part of the reason I'm requesting brain donation is because that's how we learn about these connections. And we still have a lot to learn. So I certainly am not going to give advice about whether you should take the drug, but I certainly encourage you to read what you can about it from reliable sources and talk to your clinician, trusted clinician, about what they've read. And I don't know if Dr. Parker or Dr. Hepburn want to add anything, but I think that's about all I could say about it.
Dr. Hepburn?
I think that's a terrific summary. And we did have a town hall, a full hour on Aduhelm and the sort of pros and cons. And the other thing I would say is that the trial was for a very narrow band. It was sort of mild cognitive impairment to early Alzheimer's, and the approval didn't make that quite so clear. And that's one of the things I think to discuss with the clinician is, do I fit into that narrow band? Even though the trial didn't show efficacy for reducing the signs and symptoms, it did remove the plaques. But do I really fit for it, especially given the cost of the drug?
Yeah, it was not only narrow in terms of the diagnosis, but also narrow in terms of it was almost entirely white and Asian populations studied. And
Right.
so if you're not in those groups, then we don't really know too much about how it works for you.
And that
Next.
underscores, I think, the point Dr. Parker has made repeatedly. We need brain donations for more than just white people.
And research participation in general
Yeah.
for the same
Right.
reasons, right?
So on that note, I'm gonna give one other mention before we end this content part of our webinar today. For the people who wanted to know about the memory study and brain donation here at Emory, the young lady that you should call is Samantha Heldenberg. Her email is SHELDEN@emory.edu. It is in the chat, just kind of look there. And again, look at our website, our Emory Alzheimer's Disease Research Center website. We want you to participate in our research. Some of the easiest things that you can participate in, if you are over the age of 65, closer to 70, we really want you in our UDS study or our memory study. That's where we're observing you every year. You're not really doing anything particular, but we would like to get some blood from you, some cerebrospinal fluid, and even get your brain on an an X-ray, an MRI, or a PET scan that may be offered to you. Again, if you're going to participate in donation, autopsy, brain donation here, again, we'd like to get to know you better ahead of time, and we do that through that study. Other centers have different requirements, but if you want to donate your brain and your spinal cord, we need to know ahead of time such that your family can make proper provisions. And as I said before, you can have a formal funeral service or traditional service, even though you've harvested your brain or your spinal cord. And giving us your brain or your spinal cord doesn't mean that you can't donate other organs, your corneas, your liver, your heart, or other things to other needs, should you not need those organs anymore. At this time, Cornelya, thank you so much, Dr. Silverberg, for participating and giving us your time this afternoon. We'll be calling you back, I'm sure.
Thank you for having me. I appreciate it. Bye.
Thank you. Okay. Ms. Cornelya?
Hey, all right. So Dr. Hepburn, did you want to share any additional updates about your caregiver research? Because 33% of participants are caregivers. And so while Dr. Silverberg and Dr. Parker did an excellent job of talking about the various research opportunities, we want to also feature caregiving studies that our center has been a part of.
That'd be great. I've mentioned before, we have a trial that has begun, a pilot trial in a fully online course called Caregiving During Crisis. Especially as this Delta surge is occurring, attention needs to return to how to protect ourselves, how to protect the persons for whom we're providing care. Even if we're all vaccinated, clearly there are a lot of breakthrough cases occurring. This course deals with that. It deals extensively with how to navigate the healthcare system. And it also provides some tips on managing the day of a life of a person living with Alzheimer's. Anyone interested in that course called Caregiving During Crisis, which has the unintentional acronym CDC, you can email me. My email is khepbur@emory.edu. So it's K for Ken, and Hepburn, I don't get the last letter of my name, so HEPBUR@Emory. The other course that is about to begin, again, fully online, self-paced, is called Telesavvy at Home. It is a course for caregiving that replicates several different versions of the Savvy Caregiver course that we've tested in the past. It's very effective in increasing caregiver skills and knowledge, improving the sense of confidence and competence of caregivers, and really helping the caregiver's overall well-being. Again, Telesavvy at Home. If you're interested in either of these studies, just email me and I'll put you in touch with the people who can provide the contact information. We're soon to have a program called Caregiving While Black, focused entirely on African-American Black family caregivers. That should come online in about a month. So another study for caregivers. So,
on that note, Dr. Hepburn, Dr. Carolyn Clevenger will be a presenter on BrainTalk Live in the next 2 weeks on September 14th. Dr. Carolyn Clevenger is director, or I don't know what the proper word is, but leads that caregiving during crisis. And she will be on in a few weeks with Dr. Cooper Smith, who is an internal medicine hospitalist who's going to educate us about COVID hospitalizations and crises at Emory University Hospital.
That's great.
Carolyn and Dr. Cooper Smith will be presenting together.
Super.
Okay, well, we are wrapping up. We always launch this poll before every program, and let me know if you can see my screen. I wanted to invite Dr. Parker to come on and clarify these 2 questions at the end. Let's see.
I can't see what you're talking about on the question and answer or in the chat.
So during the pre-event, right when we are kicking off every session, we have a poll, and the next to last question asks, the kids and grandkids show up for their weekly regular Sunday dinner, and you completely forgot they were coming. So 48% of respondents said this is a warning sign of dementia, and 52% said this is normal aging related memory loss. Which response is correct?
I'm going to lean toward the latter part, simply because a lot of us don't write stuff down and we don't remember that we agreed to something that we agreed to. That doesn't necessarily mean that you've got Alzheimer's or dementia. That means you need to plan better. If there is, however, a pattern of forgetfulness, a pattern of making appointments, writing them down, and then forgetting that we even made those appointments, that's something that's a little bit more worrisome. Forgetting where you dropped your keys is not a sign of dementia. Maybe a sign of disorganization, but it's not a sign that you've got dementia. But if you're repeatedly losing things that are important, that are routine, casual sorts of things, that may be a problem. If you are driving your car and your family has noted that you're getting lost, and you note that you're getting lost and having difficulty remembering how to get from point A to point B, that may be worrisome. In any event, whether it's losing your keys, forgetting that your grandchildren are coming, or getting lost in familiar places and you're concerned about it, please address it with your primary care doctor. If you don't feel comfortable with discussing this with that particular doctor, please find a doctor that you can discuss it with. Because there are some things when you discuss them with your doctor that indicate you need further testing. And just by talking to somebody without the benefit of an exam doesn't mean that you have Alzheimer's. And no matter what it is I say, unless I'm looking at you as a patient and have in front of me your medical records, your history and medicines and things that you're taking, I really can't advise you appropriately. So if you're concerned about your memory, if you're concerned about somebody else's memory, take the time to schedule an appointment with that person's doctor or your doctor. Take a family member with you and write down all of your questions so that you can get and generate the most proper assessment. Here at Emory University, if you want an evaluation in the cognitive neurology department, you must be an Emory primary care patient. That means you're seen by an internal medicine doctor or a geriatric medicine doctor here who makes a referral into the system. No doctor is going to be able to make a neurologic assessment without having a comprehensive medical clearance from whoever your primary care doctor is. That means your diabetes has to be in control, your thyroid, your heart disease, all of that stuff has to be normal. You can't just walk into a neurologist's office and expect a diagnosis.
Monica, can I just put a pitch in for the Georgia Memory Net? Because I think your point about if you don't believe your physician, your primary care physician may be able to make this, ask for a referral to the Georgia Memory Net Memory Assessment Clinic. There's 5 of them around the state, and they do exactly what Dr. Parker has said. They have the capacity to provide the expert diagnostic workup that can give you a really much more definitive answer to the question.
Okay, Matt, you have 2 minutes to tell us what we can expect for the Cognitive Empowerment Program at 3 p.m. today.
Hey everyone. So for CEP Community Live, we are going to be joined by Suzette Binford. She is our great social worker here on the study, and we're going to be talking about how to deal with financial like fraud and abuse and topics related to that. So please come join us if you're interested.
Okay. Can you drop the link?
Yep,
There
I
it
just
is.
dropped the
Okay.
link in chat right now if anyone
All right.
would like to register and come join us.
Yeah, and if you, again, it's a separate link from this link. So if you are on this link, this is only for BrainTalk Live. There's a new link for the Cognitive Empowerment Program that Matt just put in the chat. So grab that link. Take the time now to grab all of the links. We don't always share the chat when we repost the programs. So this is a good time for you to grab all of those links. Many of them were posted today. We will do our best to retrieve them and share them next week, but sometimes we don't always get them. So this is your opportunity to grab all of those useful resources, those email addresses, those links right before you head over to CEP. You've got a little over 60 seconds to scroll through the chat and take care of that. And yeah, okay, Crystal, if you logged in late, I don't think you can see the chat prior. It's only going to show you the links once you got online live. Okay. Who is eligible for the caregiver population? If you would probably just reach out to Dr. Hepburn, Crystal is going to repost his contact information and he will connect you to his coordinators. But Ken, is there an age limit on the caregiving?
No,
and
well,
prices? Okay.
anybody over the age of 18.
Okay.
And yeah, someone asks, would I recommend taking one course at a time? Yes. Both courses have a lot of material. If you're actively caregiving, you want to give attention. I would take one after the other.
And
Oh, and the caregiver population is for caregivers of persons living with dementia.
okay, thank you for clarifying. Okay, well, we know we have an extended weekend coming up for Labor Day, but we're still going to be here. I think we'll have 2 guests. I will post their credentials and make sure you tune in for next week's program after Labor Day. We want to see you all engaged and online with us, even though it's the day after holiday. Again, do your best to keep your distance, wash your hands, and wear a mask. We're still in this together. And thank you for joining us. We will see you back here next Tuesday at 2 p.m.